My name is Keith Knabb, and Affordable Medicare Solutions is my company, and we are the leading Medicare educator in Georgia. I pioneered Medicare education back in 2008 or so after working with the state agency called Georgia Cares. Their director came to work for me at my agency after she left the state of Georgia work. So let's talk today about managing your Medicare. And we're going to spend about 40 minutes talking this subject. But boy, if you really wanted to become a Medicare nerd like me, I could talk for 40 hours about this subject. I'm sure I would put you all to sleep. So let's take a look here, and I'll share my screen and we'll move forward. This session is called 2024 Managing Your Medicare. What this class is about is preparing for 2025. Now, I have different classes that are Medicare soup to nuts. There are different types of classes. Some classes are 5 minutes long. Some classes are an hour long. Today, this is just about managing your Medicare, especially related to the massive changes coming due to the Inflation Reduction Act. The Inflation Reduction Act is the big bill that President Biden got Congress to pass. Vice President Harris cast the tie-breaking vote to make it 51-50. Compliance, housekeeping. This presentation is for educational purposes only. I am not employed by Medicare. I do this as a public service. Complete information is available at medicare.gov. Never, ever, ever go to medicare.com unless you want to get more illegal phone solicitations and robo-texting and all sorts of calls and emails. If you'll go to medicare.com, you're going to get into the vortex. Don't do that. Stay at medicare.gov or go to my website, which I'll share with you at the end of this presentation. No plan names, companies, or prices will be shared today, and additional educational flyers with detailed information are available at my website, as well as a huge library of great videos, and a lot of the videos are just explanations of the education flyers. Today's topics: who is Affordable Medicare Solutions, AMS? That's my agency. Why is Medicare modernizing? What does that mean? And when does it end? Management periods. This means when can you update and change and improve your Medicare? Your medicare.gov account. What do you do there, and why is it important? Annual reviews. Why do you want to do annual reviews? And then this drug timeline. That means the changes to the prescription drug coverage under Medicare, the good and bad effects, and when do those effects happen? And then Affordable Medicare Solutions resources and your next steps, what you need to do yourself, and some things you need to do with my agency. So some things you'll be able to do yourself, and I'll teach you today how to do those things. So AMS is my agency. We are now entering our 30th year of service. We are a dedicated team of 10 professionals, and we do everything in an educational basis. We want to make sure that the seniors and their families, especially the adult children, understand Medicare. We represent the client, not the insurance companies, and all of our services are completely free of charge. We are paid by the plans. Medicare set it up that way so that the consumer does not have to bear the brunt of the charges. Our agency serves all of Georgia and is the most award-winning Medicare agency in Georgia. As an example, we're the only agency in Georgia that has won Best of Georgia, Best of Atlanta, and Best of Gwinnett all in the same year. And I'm going to stop my screen share for just a moment and make sure that we share properly. All righty. So on our presentation today, the first thing I want you to learn is that Medicare is not set it and forget it. The insurance companies love it when you don't pay attention. They sneak up the prices and change your coverage, and they really enjoy people who set it and forget it. It's very profitable for them. Money in their pocket is money out of your pocket. So a big mistake would be to not manage your Medicare. It affects your finances, but it also can affect your health. Very important. You need to manage your Medicare every year because changes occur every year. And now there's even more expanded help for low-income people or people with chronic illnesses. We've added a couple of categories such as end-stage renal disease and dementia as more chronic illnesses on top of cardiovascular disease and diabetes as targeted programs that Medicare wants to help people with. Yearly changes to plans will affect your out-of-pocket costs, your deductibles, your drug costs can go up and down. When do you have to spend money on drugs? We're going to spend a lot of time on that today. And then which providers you can see and what pharmacies you can use. That is going to be changing quite a bit next year. So our biggest question that we have is, why does Medicare come in so many shapes and sizes? And why don't they just make it one size fits all? Well, before I even talk about Medicare plans themselves, remember, some people on this call might have veterans benefits. They might have union retiree benefits. They might have state health benefit of Georgia for teachers' retirement or administrators. They might have AT&T or IBM retirement. So lots of different Medicare plans and different retiree coverages are out there. What we're going to talk about right now is if you're a normal consumer that does not have retirement benefits, you do get to choose between using traditional Medicare or the new modernized side of Medicare. So traditional Medicare was created in 1965, whereas the modernized side of Medicare got kicked off 20 years ago in 2005. So it's very important that you understand under traditional Medicare, for all of those years, about 40 years from 1965 till 2005, it was pretty much a static program, and insurance companies heard from people that said, Medicare doesn't cover everything. Can you sell us a little policy that'll improve Medicare? So they did. They created a myriad of policies. The government came in and sort of tamed the mess and standardized everything and called them Medigap or Medicare supplement policies. These Medigap plans ride on top of Medicare, and they just lay silently in the background. Medicare makes all your decisions on traditional Medicare, and your supplement, if you have one, lays there and does not talk to your doctor or your hospital. It just pays the bills after Medicare approves them. Now, certain times of the year or certain times of your life, Medigap insurance plans are guaranteed issue, which means you don't have to answer health questions. Sometimes you will have to answer health questions to qualify, and we know those rules, and I could teach a whole class just on those rules. The Medigap plans have either low or even no deductibles for some of the older seniors, but you do have to pair them with a prescription drug plan. So that means under traditional Medicare, you would have a red, white, and blue Medicare card. Then you would have a Medicare supplement card and a prescription drug card. That's the 3-card system, and that's the way it was developed over 40 years. Now, you can change a Medigap plan any time of the year. If you get a rate increase in June, just call my office and we'll shop that plan for you. We may have to do some pre-screening under underwriting rules. Some people get to change plans, some people may not be able to. Now that varies by state. So if you have a brother or sister in Missouri or Connecticut, they have different rules. They don't have to answer health questions. They have different rules in those states, but Georgia does require health questions generally. Now, the new side of Medicare on the right-hand side of the screen is called Medicare Advantage, and this is what you see advertised tremendously on TV. You see Joe Namath, you see Jimmy Dynamite, JJ Walker, all these clowns are on TV all the time pushing, get your extra Medicare benefits. They're talking about the new side of Medicare. And I'll be very clear about this to you. Half of my clients use traditional Medicare and half of my clients use the new modernized side. And it does not matter about your income. I have very low income people that are under traditional Medicare, and I have very rich people under the modern Medicare side. So the income isn't the issue. What's generally the issue is that all of the extra benefits in Medicare have been loaded up only under the Medicare Advantage system. So the Medicare Advantage plans have oftentimes optional freebies, and the word optional is very, very key here. They're not mandated benefits. They can give you extra benefits like dental, vision, transportation, hearing aids, over-the-counter items like, vitamins or diapers, all sorts of stuff that are not mandated by Medicare, which means they are a 1-year promise. A plan will file their plan, sell it for 2025. In 2026, it can have different benefits. And we're seeing a huge pullback in those benefits under a lot of the plans for 2025 due to the Inflation Reduction Act. Now, these plans have no pre-existing conditions. You don't have to ever answer any health questions. You can move to a new Medicare Advantage HMO or PPO every year or when you move. There's different rules, and we'll go over some of those management periods in just a moment. But let's spend one more screen understanding the difference between traditional Medicare with a supplement versus the new Advantage plans. There are 3 columns on our screen. The first column is, what doctor can I see? The second column is, what the heck is this going to cost me out of my shrinking monthly budget? And then the third column is, what the heck is it going to cost me when I get sick to get better? So the top line of the screen is for the supplements. The supplements, you can go to any doctor who accepts Medicare, but that doesn't mean you can go to any doctor. You have to go to doctors who are willing to see you, because not all doctors who accept Medicare are adding new patients. Have a conversation with your doctor or your hospital. These supplement plans are more expensive because they are going up in price. We're seeing a lot of rate increases this year, 10, 15, 20% rate increases, very similar to auto insurance, how those have been going up lately. And you have to buy a separate prescription plan. Well, between a supplement and a prescription plan, you might be looking at $250 per month. Well, that's $3,000 per year per person. A husband and wife would be $6,000. But hey, on the last column, it says nearly 100% medical coverage is available. You go to the hospital and come home, you're not going to have any bills on most supplements. You go to have a new knee put in, a new hip, all that, you might not pay anything. Very, very good, effective coverage, but it's also very boring. There's no other bells and whistles there. It's just buy your supplement, get your free coverage. So there's no such thing as free. You've actually prepaid. If you see here on the left-hand side of the column, it says prepay. We very much categorize these like warranties. You don't get a free refrigerator. You buy a warranty, and the warranty gives you a free refrigerator because you paid for it. Now, if you go to the bottom of the screen, which is the Advantage plans, these are pay as you go, which means when you need care, you'll pay. But in order to find a doctor, you would look at your network list of doctors, very similar to what you've had at your work. Every year at your work, they might give you a little packet and say, hey, choose your plan for next year. You have a choice generally between an HMO, which means a mandatory small network, or a PPO, which means an optional, large, potentially national network. Same thing in Medicare. And if you go to that open PPO style of plan, you can go, you have access to any Medicare provider nationally that's willing to see you and build the plan. These Advantage plans, almost all of them are $0 per month. However, for 2025, a lot of the plans are adding a premium of $15, $20, or $30 per month because of the Inflation Reduction Act. And you have copays for each service, such as going to the doctor or the hospital. Those copays are also increasing due to the Inflation Reduction Act. So every time they say inflation reduction, and I'm talking about things that are going up in price, sure sounds like the Inflation Production Act, doesn't it? 100% coverage is not available, and you're protected by an annual out-of-pocket maximum rule. What that means is, yes, you have to pay for services. You have a $50,000 set of heart stents put in, and you're in the hospital for a day or two. You might pay $300 or $400 for that surgery. No big deal. But if you had stage 4 cancer and you were in treatments for a year under cancer, yeah, you might end up spending $6,000 or $8,000 or even $9,000 out of your pocket. It depends on the plan, and those out-of-pocket risk numbers are going up again next year because of the Inflation Reduction Act. So let's talk about the times of year that you can actually manage your Medicare. We're going to answer questions at the end, and I'll be willing to stick around and answer lots of questions. But if you'd like to, in the chat box, you can put in your questions also. And it just doesn't show up on my screen, so I won't see them till the end of the presentation. The enrollment periods. Enrollment periods, such as your initial election period, is when people turn 65. Also for disabled people when they're awarded their disability award. But that initial election period, a lot of people go right past that because they continue to work at a large employer with 20 or more employees. And they might then say, hey, I'm 68 years old and I want to start my Medicare. Well, that would be a special event, a special election. So the initial election is when you're turning 65, and the special election is for things after that point. So there's lots of special events. COVID was a special event. Hurricanes, tornadoes, floods, snowstorms, ice storms, hurricanes, we're getting ready to have one, can create special periods where I manage people's Medicare. My favorite one this past year was the tragic loss of Rosalind Carter, the wife of President Jimmy Carter, the First Lady of Georgia. Well, the state of Georgia made a proclamation to honor her for her parades in Plains, Georgia, and in Atlanta. And that caused the federal government then to give me the ability to manage people's Medicare due to her death. And that's odd, isn't it? Well, the funnest one ever that was odd was if you were affected by a peaceful protest, I could manage your Medicare. So how would you even know all of these things? You need a Medicare nerd like me, because even if you call Medicare themselves, they don't even know their own special election rules often. It's like calling the IRS. They sometimes don't even know their own special things that are happening. The next one is the annual election period. This annual period starts on October 1st for a preview for 2 weeks. So October 1st through the 14th. The official date where you can actually make changes during this annual election period is October 15th. So the first 2 weeks, we were able to get a running head start and see all the new plans. And then October 15th to December 7th, we're very busy managing our clients and friends and referrals, their Medicare benefits for January 1st. Now, what you manage during that time period is your prescription drug coverage and your Medicare Advantage HMO or PPO plan. Your Medicare supplement, you can do any time of the year. Now, the very last column, called the Advantage election period, is something that President Trump created to help seniors who were stuck on the wrong plan because they didn't do their annual review. 90% of seniors aren't paying attention to their plans, and they just let it ride to the next year, and then they find out they've got huge problems in January or February, where President Trump said, hey, look, if you find out you've got a problem, January, February, or March, you can make a change and we'll take care of you. Also, special needs plans for low income and specific chronic illnesses get a once per quarter flexible choice. We can help them more often to take care of their Medicare changes. So let's talk a little bit about this. Let's talk about this Medicare Advantage open enrollment period that President Trump created. And President Biden loved it so much that he continued this because it is very pro-consumer. You would find out in January or February when you go to the pharmacy that your drug wasn't covered, or that your doctor was not on your plan, or your cancer treatment center was not on your plan because you didn't check during the annual review period and you were stuck on the wrong plan. Well, we don't want seniors to be stuck. We want to give them some relief. So I can make a change. I can either find them a new Medicare Advantage HMO or PPO. Most people choose the PPOs. Or they can exit the Medicare Advantage system and just move into traditional Medicare. Doesn't mean that you can automatically be guaranteed Medicare supplement, but you can just bounce back to traditional Medicare during January, February, and March. And it does guarantee you the ability to pick up a new drug plan, a standalone drug plan. Now, this enrollment period has a rule. It says if you did make some changes during the fall review period, you're not supposed to use this January, February, and March period. We've been told by some of our insurance companies that they don't want to apply that rule, and they go ahead and move people to a new plan and don't worry about that because they don't want somebody stuck on the wrong plan, because then people make complaints and it hurts the system. So let's just go ahead and find them the right plan. Remember, if you're on traditional Medicare as of January 1 and you call me and say, Keith, I've got the wrong drug plan, I'm sorry, they have not made this period apply to regular standalone drug programs. You have to make those changes before December 7th. Really important. So now let's move forward to talking about how you can do things for yourself, because the government doesn't want me doing a few things for you anymore. So let's talk about Medicare.gov, which is your federal account. I use this website every day. Savvy, smart seniors use this account. If you're under traditional Medicare, for sure you need a Medicare.gov account, but I think everybody in Medicare should create one. And you can manage your account information. You can print either replacements or just extra Medicare cards in case you want to give one to your daughter to have on file. You can see in-force status of all your Medicare plans. Sometimes people forget what plans they have, and we show them. This is what Medicare says you have. We can then also research and select updated Medicare plans, specifically new standalone RX drug coverage plans for 2025. You can also see the Advantage plans under Medicare.gov, but do not select an Advantage plan at Medicare.gov. There's too many moving parts. They don't show you quite everything. It's kind of cumbersome. My office knows the differences between all the different carriers with the specific details. We make it very simple for you, but it is very simple for you if you're under traditional regular Medicare, and for you to pick a new drug plan is actually very easy. So what can you do? You create your Medicare.gov account by putting in your Medicare number, put in your last name, email address, date of birth, zip code, and when your Medicare started, create your login and password. So 1 minute into it, you are in your Medicare account. Very simple. No two-factor authentication yet on this account. Very simple. View my claims. This is important. If you went to the hospital or your loved one did, and they're getting a stack of bills on their kitchen table, you can look up to see whether those bills have already been paid. Medicare will show you if you're under traditional Medicare. If you're under a Medicare Advantage HMO or PPO, you'll need to create a login at that plan. So the bluecompany.com or the greencompany.com, go create your member account and you can see your claims there because Medicare pays them to take care of you. But if you're under traditional Medicare, it'll show your claims payments. If some ambulance service is sending you a bill for $3,000 and you're like, wait a minute, I've got Medicare, and you go into your Medicare account and you see that the ambulance company never billed Medicare. I've heard this story before. People call up and say, hey, my dad's got this bill for an ambulance service. Why didn't you guys bill Medicare? And they literally said this to one of my clients. We didn't know your 98-year-old grandfather had Medicare. Okay. Of course, they knew that. They just wanted to bill $3,000 instead of getting paid $1,200 by Medicare. They didn't want to get the discount, apply the discount. They wanted to get the full retail. And oftentimes people just stroke checks. They just sit down at the kitchen table and start writing checks. Don't do that. You can manage your account. You can pay premiums. You can update or print your drug list. This is very important. Any drug you're using under your Medicare drug coverage will show up in this account, even if you're on an Advantage plan, and your pharmacy now will show up. Well, this is important. If you're using GoodRx or Mark Cuban drug, Cost Plus drugs, or Canadian drugs, or Israeli drugs, you've got to add those drugs to have a complete list. And it's important for you to have a complete list of your drugs if you're printing it out, so that when you're on vacation, you put that drug list with you, so that if something happens to you, they'll know what is in your body, what you're taking. Emergency rooms really appreciate that. You can print another copy of your Medicare card. You can look up doctors. Now, because all of your drugs are listed in this account, it makes it very simple for you to do a prescription drug review. Very, very simple. And when you do your prescription drug review, you first want to make sure your drug list is correct. And then you'll click on Find Plans. October 1st, October 15th, it'll have a button that says Find and Shop New Plans. You just click on there. It'll pull in your drug list. You can make sure that your drugs are correct and make sure your pharmacy is correct. You can add 2 or 3 pharmacies if you want to compare prices. That's fine. I recommend that because those preferred pharmacy lists are changing for 2025. One of the companies is actually owned by CVS, And CVS is not even preferred on their own plan. Wacko, right? That's just crazy. They only give people preferred drug prices if they order it through mail order. So even if you drove over to your local CVS, they would charge you more. Crazyville, and that's part of the Inflation Reduction Act impact, ripples in the pond of Medicare. So why do annual reviews matter? You must make sure your drugs and pharmacies are covered next year. When you do this drug review, you'll click Find and Compare Plans. It'll then pull up and say, hey, there used to be 30 drug plans per county in Georgia. This year, there's 20. Next year, there's going to be 10 or 11. Again, that's been shrinking down. The choices have been shrinking with the government changes. And you'll say, well, wait a minute, my plan's not even showing. Well, some plans are being canceled. They're being canceled and they're being rolled into other options. So you might get a note that says, in a letter in the mail that says, hey, your plan has been canceled and you need to find new drug coverage or you'll have no coverage as of January 1st. Or the letter might say, your plan has been converted. We are migrating you to another option. We're doing you a favor. We're moving you from your desirable $15 a month option to the new $60 a month option, and you should be grateful. No, you should go shop your plan and find the right one, because the average error is about $1,000 per senior. So the insurance companies love that. That error is in their favor, of course. By doing this review, it'll say you're on the wrong plan. Here's the right plan at your pharmacy that you put in, and your drugs on your current plan are going to be, $1,800 next year. On the correct option, your drugs are going to be $700. And it'll be the same drugs from the same bucket at the same pharmacy. It's crazy. And we're going to go over some of the impacts. Some of them are positive. I'll share with you in just a minute. You want to make sure your doctor and your hospital are covered. Some doctors are selling their practices. We're having a lot of doctors retire. Some doctors are not adding more Medicare patients. You want to make sure you're not being overcharged or ripped off on any of your plans on their premiums. Premiums have been going bananas on some plans. You need to be advised of these new Medicare rules. We're going to go over the Inflation Reduction Act, as well as we already went over the new January, February, and March rule for changing Medicare Advantage plans. But whoever's your advisor, whether it's me or some other friend or person, your Medicare advisor needs to know about any upcoming life events. Like, are you going to move? Are you leaving Georgia for South Carolina? Or do you have cancer? Or did you just get diagnosed with dementia? You might not have been seeing many doctors in 2024, but man, if you've got a cancer diagnosis, you might be seeing a whole slew of new doctors for 2025. So here's some of the positive news. The positive news is the Inflation Reduction Act's focus on prescription drug costs. So what happened was President Biden wanted to fix Medicare. They wanted to say, why does regular Medicare Advantage have all the bells and whistles, have dental, vision, and hearing aids? Why don't we give all of Medicare dental, vision, and hearing aids? And he created an act called the Build Back Better Act, or bill, and that bill did not get passed because it was $7 trillion, and we had just spent $6 trillion on COVID, and Congress said, heck no, we're not going to give you another $7 trillion. So he pared it down to $1.7 trillion and counting under the Inflation Reduction Act. Well, what happened was the only thing they could really focus on for seniors was prescription drug costs. And a lot of this is happening in an election year. It's pretty convenient how they timed that out. They're smart politicians. And the big one for 2025 is a huge gift to seniors. We're going from an $8,000 drug risk for seniors per person to only $2,000 cap. What that means is that's your cap on your out-of-pocket drug cost. Doesn't mean that you can only spend $2,000 on drugs. It means that if you have $10 million of drugs, your portion out of your pocket is only $2,000. You still got full drug coverage. This is a huge deal. They didn't know how big of a deal it was, but it was such a big deal. The insurance companies freaked out, and a lot of things have happened over the summer. I'll get into that in just a second. The insulin price cap, though, was created by President Trump, and that was already being migrated in, a $35 monthly cap on the cost for insulin. Well, regular people that aren't even on Medicare are now seeing some of their insulin prices coming down to $35 or less. We're seeing that happening. And some of my seniors are even paying $12 or even as low as $0 for their insulin. So there has been some improvements. President Biden loved what President Trump did on insulin, so he expanded it because Trump forgot to include people using insulin that wore a pump. You wear a little pump on your belt, and that's your insulin monitor. Well, that got left out of the first bill, so President Biden fixed it, and the new bill includes all types of insulin, including pumps. So there's a constant state of improvement on that regard. So this protection of $2,000 cap, we're going to go over a lot about that because it's got some big impacts. So one of the big impacts was that they thought about this, and I'll tell you a couple of stories that are what happened in the back rooms of the Medicare services bureaucracy. The government passed the bill. The insurance companies read the bill. The insurance companies had to file their plans in May of 2024. So they did. They met the deadline. They all filed their 2025 plans in May of 2024. The federal government read through those filings and did their spreadsheets and analysis they do every year to see what is the average value and what's going on with the plans. And they completely freaked out because the insurance companies had tripled the price for prescription drug programs and reduced the formulary lists of drugs and increased all sorts of things, the cost factors for seniors. And the government said, oh no, seniors are going to find out about this in October when they get their annual notice 1 month before the election. They said, we can't allow this to happen. We get 10 million, ticked off seniors, that could swing an election. So they immediately got to working, did not talk to Congress about this, and they approved to triple the subsidy to the insurance companies. Well, by tripling it from $61 per month to $172 per month, they went back to the insurance company and said, hey guys, we got a couple rules here you got to obey, but we're going to triple your subsidy if you'll play ball. And the insurance company said, man, this is great, thanks. Just hand us some more money without congressional approval. The Appropriations Committee is really mad about this because these bureaucrats just approved to buy off the insurance companies and to fund this change on the prescription drug program. So they did. And instead of tripling premiums, some are going up quite a bit still. We're actually seeing 1 or 2 plans go down in premium. Bizarre. I don't know if that'll be that way in 2026. But for 2025, we actually had some plans go down in price due to this tripling of the insurance company subsidies. Well, then some bureaucrats said, all right, well, what about this, though? What if Mrs. Johnson loves her new $2,000 cap on her costs, but she gets hit with all of those costs in January? She's got some big expensive drug. She might freak out and complain. So why don't we create a program where we give seniors a free $2,000 interest-free loan, no fees, no interest. We're just going to hand it over to seniors regardless of their income. Bill Gates can get this benefit, or a low-income person can get this benefit. It's called the Prescription Plan Smoothing Provision. The official title is the M3P, Medicare Prescription Payment Program. And what it is something you can opt into. So once you choose a new plan after October 15th, you get your welcome packet. You can call your plan and say, hey, I want this free benefit because I expect, based on my Medicare report that I ran my report on Medicare.gov, it says I'm going to spend more than $2,000 next year on my drugs, or I will spend $2,000 to my cap, and I don't want to have that hit me in the first of the year. And they'll automatically have to accept you. There's no gates to go over or hoops to jump through. You'll automatically be accepted by opting in. They will send you a coupon book where you'll pay $167 per month. for every month for 12 months. That's $2,000. So they smooth it out over the whole year, no fees, no interest. It's a free deal to you. And when you walk into the pharmacy, the pharmacist is required to hand you your drugs for free. Now, I've talked to a couple of pharmacists. They have no idea about this program. So I don't think the implementation of this program is going to be smooth. I think it's going to be crazy. I think it's going to be very much a boondoggle for the first probably 3 to 5 months, because the pharmacists aren't even getting training yet on this. One of our insurance companies, the Blue Company, is already contracted with a provider that is going to assist people with this. But from my other 7 or 8 insurance companies, haven't heard a peep from them on how they're going to implement this smoothing provision. Only one carrier so far has given us really a peace of mind on this. Agents are forbidden from helping you with this program. I can teach you about it, but I can't assist you with opting in. You have to call the plan yourself. The plan has to notify your pharmacy. You can discuss this with your pharmacist. Don't expect them to really know it. If they know something about it, they're probably not going to know the whole thing until they've been hammered on this for January, February, and March. And if you don't like the program, if it's too complicated or something else falls apart, you can always opt out. So this is important. They've not told us, well, what if somebody sends in their money and they don't actually spend $2,000? Are they going to get a rebate? They haven't even told us yet. We don't even know the answer to that question. So this is important. It's the M3P program. It'll be in your welcome packet, explained to you when you get your new plan. So here's the timeline of prescription drug changes. They started in 2023, and then in 2024, we saw some big changes, especially some expansion of what is called low income. They expanded that by 10% due to all the inflation that the government has caused. And so we've got more people qualifying as low income, but a lot of people have failed. About 20% of all seniors who qualify as low income have failed to apply or reapply under the new definition. In 2025, there's this new $2,000 out-of-pocket annual cost cap. I need to update my sheet to also put in the smoothing provision, to put that on this little flyer. And then starting in 2026 through 2029, they're going to negotiate 60 of the highest cost Medicare drugs that represent about $60 billion of excess Medicare spending. We know the drugs are much cheaper in England, France, Germany, Italy, and Canada than what we pay. We've been getting ripped off on a lot of drugs. And a good example is a drug called Eliquis. Eliquis is a drug you take as a blood thinner to prevent clots for people who have had heart surgery or had a stroke or something like that. And that drug is $500 a month in the United States. In Canada, that drug, for a brand name version of it, perfectly equivalent version, same manufacturer, same factory, is $50 per month. So you can get a drug for $50 per month in Canada, and we can't get that here in the United States. So what do a lot of people do? They order it from Canada. You can get the generic in Canada for $35 a month, and we can't even get the generic here. So they're going to start negotiating those drug prices. Even after the first round of negotiations, the New York Times did an article and said, we're still paying double what these other modern countries are paying for the drugs. So we're still not getting the best deal. The insurance plans have filed lawsuits. Many of those lawsuits have been kicked out. There's still some pending to try to prevent this government price negotiation. They're screaming bloody murder. And yet some of the CEOs from the insurance, these insurance plans, pharmaceutical plans, came out and said, this is not going to really affect us. I'm not sure what to believe, because if it's really not going to affect them, why didn't they do that 5 or 10 years ago? So I don't buy their stories. In one hand, they're filing lawsuits, and then some CEOs are saying, no, it's not a big deal. Now, at the very bottom of your screen, you can see that it says that these drug programs are now limited to no more than 6% premium per year based upon the national average premium. So why are so many plans canceling for 2025? They're canceling to avoid this rule. By canceling, they can just migrate people over to the expensive option, and they'll say, well, we didn't raise their price more than 6%. We just canceled their plan, and we wanted to make sure they had coverage, so we did them a favor and we move them over to the more expensive option. So that the reason they're doing that is to avoid this 6% premium growth rule. Pretty much, they always look for a loophole, and this is how they're exploiting the loophole for 2025, offering fewer plans. So are all Medicare agents the same? No, they're not. Most Medicare agents are set it and forget it salespeople. If you've ever walked out, walking your dog one day, and all of a sudden in your front yard, you see a bunch of mushrooms. They're there for a week or so, and then they're gone. That's what we call these Medicare agents that magically pop up in October and November and sell people Medicare at Walmart, Walgreens, on TV. It's just, they're mushroom agents is what we call them. They're not career professionals. They are agents that have sales quotas. They share their commissions with Walmart or Walgreens. And this is important. Those people aren't going to give you service. They're not going to take care of you. There's only a very small percentage of Medicare professionals here in Georgia or nationwide that offer annual management and year-round service with a team. Most Medicare people are a one-man band, which means if Joe's your Medicare guy and he gets in a car crash, you don't have a Medicare guy anymore. You want to deal with a place that has a team so that if your Medicare person is on a cruise, the team still takes care of you. Make sure that you only use a Medicare professional that'll show you all the options and not just a select few that they like or that they get paid on. So this is really important. The reason why people that have traditional Medicare with a prescription drug program need to go to Medicare.gov is because most of the plans don't use agents for the drug coverage this year. Medicare Advantage is a separate subject, so I'm just talking about Medicare prescription drug plans. You'll need to go to Medicare.gov to see all the plans. If some agent tells you, oh, I can help you with your drug plan, and all they're showing you are the 2 or 3 options that he makes money on, he's not showing you the market. So that's why you need to go to Medicare.gov and do it yourself so that you're not getting tricked. Even if you have a retiree program that helps you pick your Medicare benefits, first go to Medicare.gov, print out the plan you want, and tell your retirement system, this is the one that I want. They may not show it to you either because they might only show you the ones that they get paid on. Only use a Medicare agent that provides their services free of charge. There's going to be a lot more scams this year of people charging to do their Medicare reviews. That's illegal under Medicare's rules. And I am an insurance counselor. I have expanded rights. I have a counselor's bond, special licensing, special testing. State of Georgia says, Keith, you can charge people for insurance advice all day long. I've met the requirements for the state of Georgia. Medicare has stepped in and said, no, you're not allowed to charge for doing this. I used to help people for a fee every now and then. Medicare says I can't do that anymore. So if anybody is charging you, they're behaving illegally. So if you're sick and tired of all the Medicare illegal solicitations, don't call Medicare. They don't care. It's not their job. It's not their wheelhouse. The federal agency that does care is the FCC, the Federal Communications Commission. So you can either call this 1-800 number, 888-382-1222, or you can go to consumercomplaints.fcc.gov. So I would re-register your phone at the donotcall.gov registry. I re-registered mine and it helped stop some of the calls. It refreshes the list. Sometimes numbers fall off that list. Data gets corrupted. But if you look here on the right-hand side, there's some rules from the FCC. If you get a call before 8 a.m. or after 9 p.m. in your time zone, that's illegal, okay? So some solicitation is allowed, but definitely not before 8 a.m. or after 9 p.m. If you're in the do not call registry, that's not allowed either. And if people are using fake or randomized numbers, that's illegal. Well, the government is trying its best to stop these calls, but a lot of them are from overseas call centers. And that's why when you pick up the phone, sometimes it takes a minute or two, a few seconds, 2 or 3 seconds for the person to come on the line because they're connecting them through the computer system. Our website is fantastic, amsplans.com. It's brand new. The new version just was put up in July. And one of the big things that our seniors ask us about is travel coverage. Do not trust your Medicare plan to provide you with good travel coverage. Remember, if it's an Advantage plan, they can give you travel benefits, but they can take it away because that is not mandated by Medicare. So if you are traveling, go to my website and you can buy great travel coverage. We recommend the Geo Blue plan, and it's very affordable and very effective. Don't rely on your Medicare for that. For example, Medicare won't fly your spouse back home with you, but the travel insurance will. So you will be better covered that way. Our YouTube channel, very popular. Our YouTube channel is doing great. There's all sorts of topics. People have suggested topics. I do all sorts of different classes. The one that Roger was talking about is called IRMA and high income. That is how Medicare looks at your income, taxable and non-taxable income. It's called modified adjusted gross income, or MAGI, to charge you extra for your Medicare. I'm going to be updating that video when the new information comes out here for 2025. But basically, to watch this video and it'll explain what Roger was talking about. Medicare enrollment periods, got a 10-minute video on that. Managing your Medicare, a miniature video on that, much shorter than this one without the Inflation Reduction Act information. Lots of information there. So this is important. Make sure that when you find a Medicare advisor, I recommend you call my office, but if you find someone else, that they will do all of these things for you. They'll resolve your problems with prior authorizations. They'll assist you with drug exceptions and appeals. I can't do that for everybody this year. I can basically only do that for my Medicare Advantage members, and can't do that for traditional Medicare people with regular standalone drug plans. We help prevent scams. People send me emails and ask me questions, and we stop them from being scammed. We review your annual notice of change. We help shop your plan when you wish to change, whether it's in the middle of the year for the Medicare supplements or the end of the year for the Advantage and the PDP prescription drug plans. Adult children love us. We take the pressure off them as far as the Medicare coverage decisions. We can help them tremendously. We explain plans and benefits to doctor's office staff. They oftentimes don't understand what's going on. I'll probably be on the phone with some pharmacists this year too. Accessing the free extras like dental, vision, and more, we help with that. We do a huge amount of education and updates by email and social media. People follow us on Facebook because I do all of these updates on my Medicare Minutes online. We help navigate provider network issues when Northside Hospital is fighting with the blue company and Piedmont Hospital is fighting with the green company. We help mitigate those worries and help people to understand what really does affect them or not. And our staff, I have a staff of 10 that gives year-round service, 8:30 a.m. to 5:30 p.m. every day. If you leave a message, we will get back to you generally no later than the next day. We get really busy in October and November, so be patient with us. But we're very, very accessible January through August. That's called a rest of year for us, and we have fewer calls that come in than compared to our circus time during the annual enrollment period. Our company is Affordable Medicare Solutions. We're in Suwanee, very convenient right off of exit 111, very, very convenient to Interstate 85. And our website is amsplans.com. You can email us or you can call us. We can do appointments through telephone, appointments through Zoom, telehealth, or you can come into our office. It's your choice. We'd love to help you. Now I'm going to stop sharing my screen and we're going to look at our chat box for all of our questions and see what I can answer on that, okay? First off, Liz asked a question here. Does the do not call registry now apply to texts? I don't know that answer. That's a very good question. I think it does. I think that's illegal use of a phone number. So I think it does apply to that. And if somebody else can let me know, I would be surprised if it doesn't. When you say the next question from Debbie is where did you say the approved pharmacy is posted? On the Medicare website. When you do your review and you put in your list of pharmacies you want to consider, it'll say whether the pharmacy is preferred or standard or non-standard. It'll tell you when you do your review online. You can also look at your plan booklet. Your welcome packet will show you a list of the preferred pharmacies, or you can log into your plan and they'll have their updated list of preferred pharmacies. We are seeing some pharmacies merging together this year, and we have in the past, so that can change as those things happen. Debbie also asks, am I able to take care of clients in Tennessee? Yes, We can help people in Tennessee, North Carolina, Virginia, South Carolina, Missouri. We've got about 6 or 7 states that we handle personally. If not, we will find an agent for you. I just referred a client to an agent in Tupelo, Mississippi, a friend of mine who is a great agent in Tupelo. So we'll take care of you. We won't turn anybody away. All right, any other questions here? Good questions. The Inflation Reduction Act is a classic example of Congress passing a bill so that they can find out what's in it. You've heard that before, and now we're seeing what's in it, and they are scrambling to come up with ways to pay for things. Congress is pretty mad that they're not being counseled on new expenditures. They're just deciding to spend $15 billion without asking, and we're going to see what that means after the election. It won't affect Medicare for 2025, but it might affect it for 2026. All right, Roger, you got some comments? You got to come off mute, Roger.
That's helpful. Debbie Brilling, by the way, runs Auditory Verbal Center, and she teaches people that can't hear, like you couldn't hear a second ago, how to speak and be an independent communicator. So thank you, Debbie, for what you do. But Keith, what a fabulous job. You are an amazing Library of Congress on this issue, the most award-winning, the pioneer of Medicare education, and wow. I always learn something, and I've listened to this dozens of times. So thank you, thank you, thank you. Again, I just want to remind you of what you didn't, if some of you weren't here earlier, just to remind you that if you have year-end questions, if tax planning questions, the taxes and your adjusted gross income do affect your Medicare premiums. So just want to make certain that you work with me on your harvesting plan, make sure the next 5 years is set out. Be happy to collaborate with any of you. My cell phone number is 770-842-2977. Love to help any way I can. Again, if you have any questions, you want to collaborate on your income, your situation. If you want to collaborate about Medicare supplement, ask Keith. If you want to talk about your financial planning, your investment planning, look, the world's a crazy place. It's always changing. The one thing I want to remind you is, even if you're already on Medicare, if you have somebody already on Medicare, make certain that you get with Keith every year. You're able to save money. You're able to learn things that you didn't know that you could do. There's so much to it. So anyway, whether it's collaborating with me every year or collaborating with Keith, thank you, Keith, again. You're awesome.
Well, we're going to go to some more questions. I noticed I scrolled up that there are some more questions, and we're going to take 2 or 3 more here that I'm going to go over, okay? So it says, Debbie asked, if you just started Medicare this year, when do you need to look at your plans again? You want to do that again in October. You want to review for 2025. So even if you started in September, the new information comes online October 1st. So you can look at prescription drugs or advantage plans we can do for you. Liz asked, what if we're still employed, either self-employed or employed in the standard sense of things, and have access to commercial insurance? Can we get an offset to the mandatory Medicare costs if we prefer to use our commercial coverage? How soon do you estimate Medicare will begin having the authority to negotiate better RX prices with the pharmaceutical companies and or PBMs? All right, first question. Commercial insurance, we have a flyer available on this subject, and it really matters on whether or not you're at an employer that has 19 or fewer employees or an employer with 20 or more. 20 or more is a large group under Medicare's rules. Well, some small groups, 19 or fewer, actually are large groups because they subscribe to a pool called a PEO, or a professional employer organization. But most small groups are a problem with Medicare because Medicare becomes primary when you're at an office with 4 people and you've got your own insurance, commercial insurance. Medicare is primary. It creates problems. So most people on small groups go to Medicare and leave the commercial insurance. Now, if you're a large group, 20 or more employees, most people take free Part A of Medicare, which is the hospital portion, no charge for that. Even if you have high income, there's no surcharge on the Part A hospital and rehabilitation coverage of Medicare. So what that does is the group insurance plan is primary. The secondary will be the Medicare, and it'll only pay secondary if you have hospital or rehabilitation costs. They can bill both. Now, on an outpatient basis for seeing your doctor and getting x-rays and things, it would just be your commercial insurance. So yes, that would then offset the fact that you wouldn't have to pay for Part B, which is the outpatient coverage of Medicare that does have a surcharge for income, and Part D, the drug program, which also has a premium and has surcharge for income. So if you're trying to offset those Medicare costs by not enrolling in those things and keeping the group insurance, that's fine. You cannot activate Medicare Part A, though, if you have a health savings account at work and you want to contribute, or your employer wants to contribute to that health savings account, HSA, not FSA, H as in health savings account. Because if you have Part A, you're disqualified from doing that. So don't combine those two together. If you're just doing regular commercial insurance, go ahead and get Part A. All right, then the next question was, how soon do you estimate Medicare will begin having the authority to negotiate better RX prices? They're already doing it right now. We're already seeing that under insulin and other drugs, and 2026 is where it's really going to kick in, but it's already happening today. We're already seeing it today. Under traditional Medicare, this is from Brad. Brad asks, under traditional Medicare with a drug supplement or a drug card, what are the costs if you have been on a very costly medication that has been low or no cost because of a manufacturer supplement when you move to Medicare? Are the costs really high? Yes, Brad, they've been very high this year, up to $8,000. But starting in 2025, they're going to be very low at only $2,000. So you may not want to do a couple of things next year. You may not want to buy drugs from a special program. You may not want to buy drugs from Canada. You may not want to use GoodRx or Cost Plus or Costco to save money on your drugs, or Walmart's, $3, $10 drug program. Because if you don't use the Medicare plan, you're not going to get credit towards your $2,000 out-of-pocket maximum. Remember, when you hit $2,000, all of your drugs are free for the rest of the year. So even though you might be able to save some money on a drug up front, you'd end up costing yourself on the back end. So you really need to do your calculation at Medicare.gov with all of your drugs, put in the expensive ones, and it's going to show you if you hit $2,000. Now, you're going to get confused. You're going to think Keith taught me wrong, because my report shows that my drug costs next year are going to be $3,400, and he said it was only supposed to be a cap of $2,000. Well, at Medicare.gov, they include the premium in the calculation to show you your total cost. And this is important because if your plan is $150 a month, that's $1,800 a year. Well, that would be on top of the $2,000 for your drugs. Why would you spend $150 a month on a drug plan if a $20 per month drug plan covers all of your drugs and your pharmacy? It would be a waste of $130 a month. So Medicare tallies it all up together so people can't play games with the premiums like that. Trick people. So you got to be careful. Read the report. It'll show you the premium cost and the drug cost. And the drug cost is not supposed to exceed $2,000 for covered medications. If you have a drug on your list that shows not on formulary, it's going to blow up your numbers. And you're going to think, well, Keith told me wrong again, because all of a sudden my numbers is $7,000. If a drug is not covered, you have to remove it off the list. Medicare doesn't cover every drug. Sometimes it's as simple as choosing a tablet versus choosing a capsule, and then you'll find out the drug is covered. So be very careful you put in your drugs the right way. And if you're okay with taking a tablet instead of a capsule, flip that around and make sure you're choosing the right drug program. If you are buying drugs from other countries, that could end up shooting yourself in the foot. The government is worried that brand name drug costs are going to explode under this bill. Certain people in the government that are worried about government spending are really worried about this, because if you've ever been on an all-inclusive vacation, you go to the buffet more often and you get the prime rib or whatever because it's already paid for. If you hit that $2,000, you can go back to your doctor and say, hey, doc, remember that drug last year you wanted me to try, but I couldn't afford it? Well, go ahead and give it to me. It's free. And they're really worried that that's going to happen under this new program. All right, so another question here. Not sure, this is from Liz, not sure if this is in the scope of today's discussion, but if you have time, it would be helpful to get your take on the recent FTC suit against PBMs for artificial price increases. I'm not going to get into that discussion, but yes, there's a lot of games going on, and they're saying, "Oh, this isn't true. The government says it's true." There's a big battle going on, and the government knew when they were putting some of these price controls on the plan premiums. They knew that a lot of the plans were going to monkey with the premiums, but they didn't expect the plans to cancel people like they have. But that's happening right now. All right, I think I answered all the questions. Let's see. All right, I saw Tom Brown. If that was Tom Brown, hello, Tom. I hadn't seen you in a while. I saw you there pop up on the screen a moment ago. All right, so any other questions, you guys can email me at info@amsplants.com, or you can call our office. We're going to have this video edited and put up for viewing, hopefully by Monday, and Roger will be able to send it around to you. In the meantime, you can go to my YouTube channel and you can see versions of this video already there. You can see lots of different information, and share that YouTube channel with your friends. Share it online if you'd like to recommend people for our services. I'd appreciate it. Just warn everybody that this Medicare season is going to be bananas more than any other year due to the Inflation Reduction Act. All right, I don't see any other questions, Roger. I think we're wrapping up for today. Appreciate everybody sticking around. That was a solid hour of education.
Awesome. Thank you again. Keith is awesome, isn't he?